if you'd like to start.
Great. Well, it's such an honor to be here. Thank you so much, Olivia, for inviting me today. This is actually the first time I've really come back to do any talks or anything with the Hopkins community since I graduated in 2017. So I'm really looking forward to connecting and hearing from all the attendees. I want this to be an informal session, so feel free to put questions in the chat as you think of them, and Olivia will help in moderating that, and we might take some breaks throughout the presentation to answer some particular questions, and definitely we'll have time for Q&A at the end. So yeah, I'm really excited to be here. I'm joining from Seattle, Washington, and we'll be, let's see, go to the next slide. I was going to say, I'd love to hear more about who you are. So if you want to put in the chat, anything about yourself, which program you're coming from, et cetera, that'd be great. But I'm going to go ahead and get started. And today I'm going to be focusing my remarks really to share what my journey in public health has been like in the NGO sector, share a little bit more about PATH as an organization, and specifically my team and program at PATH, which is the health systems team and the primary healthcare program, and then really spend a lot of time on reflections from the sector, happy to answer questions about, getting into the INGO space, what it's like, day in the life sort of things. And also wanted to mention that one of our senior global recruiters is also on the line today and is here to also field any questions that you might have. And she'll also be joining the upcoming career fair, I think is in early March, representing PATH. So without further ado, I think we all go through a pretty windy path in public health. There's a lot of twists and turns. You don't really know where you're going, and you test out a lot of things. And so I thought I would just start by showing kind of all the varied directions I've taken, and starting really from the point where many of you might be at. I don't know if there's master's or PhD folks on the line, but I'll be speaking to both. And let me just, hide this if you're still seeing this. So sorry, in 2005, I moved to DC right after college, started an MPH program, focused on epi and biostats, and really got my start working in domestic HIV research through that program. Global health was not really on my radar. I had been interested in public health through a medical geography course in college, but really wasn't thinking about international health as much. I then, through that master's program, started working on the National HIV Behavioral Surveillance Study Site in Washington, DC. And there's a sister study to that, the Be Sure Project in Baltimore, which some of you might be familiar with. But super great experience, lots of varied work, from interviewing people and doing HIV tests on the van to eventually managing the whole data collection and management analysis process. And partway through there, I got an opportunity to start working with the Elizabeth Glaser Pediatric AIDS Foundation. So that was really my entree into global health, international health, and actually implementation research, which is one of the areas I'm structuring the talk around today. And that project was looking at how to integrate syphilis testing and HIV testing in the antenatal setting in 2 countries, in Uganda and Zambia. And I really just felt like, okay, this is so exciting. We're doing real world research. We're trying to figure out how we can do this better and increase uptake and increase health system efficiency to make sure these things are happening for individual women attending antenatal care and just make the experience better. So it was really exciting. I was splitting time between these 2 projects, domestic HIV, global international health, and HIV, and really, loved that experience. And from there, I wanted to get more involved and do more work in international health. So after that project ended, I started working with another foundation Clinton Health Access Initiative, and so was doing similar work. I've always kind of stayed in the analytics and research and evaluation lane, and moved up to Boston. I was working in their program, the Applied Analytics team, for a couple of years, then headed to Zambia for a year to conduct a process evaluation on the community health worker rollout, the community health assistant rollout in Zambia, which was a new cadre of healthcare workers that was an official cadre, which was exciting. They were going to get paid. And this was another strong implementation research experience for me. It was the first time I was doing a process evaluation to really understand, how is this rollout going? What are we learning from the scale up of this new cadre in different provinces? And how is that going to inform the scale up going forward? How can we make the process better? And it was somewhere in that year in Zambia that I decided that I really wanted to go back for a PhD and get more training in implementation research and mixed methods approaches. So I can't recommend trying to apply for grad school when you're abroad and when you can't really get much access to GRE testing, but somehow I managed, and ended up in 2013 starting the International Health Program in Health Systems, the PhD program. And if some of you are in that program, I'm sure you're very familiar, but there is a, really there was about 2 years of coursework followed by 2 years of dissertation work. And my dissertation work was in Tanzania, focusing again on community health worker programming, which had really been informed by my experience in Zambia. And I was looking at how a cadre of volunteer community health workers could integrate their scope of work across HIV and maternal and child health, and whether there were any challenges with that. Was the workload going to increase so much that there were diminishing returns? Were they able to maintain that workload and maintain performance? So really have appreciated working in the health systems space, and specifically the community health piece of health systems. And while I was furiously writing my dissertation and trying to graduate, trying to get everything together before the presentation in May, I remember distinctly one afternoon stopping writing and just starting to job search. And I saw this job at Path, and it looked so interesting to me because it was exactly framing, the importance of mixed methods research, implementation research, and it seemed like a really cool project. So I applied on a whim, and everything ended up working out. And I moved to Seattle shortly thereafter, after defending, which one piece of advice is I would take at least a month off between the program at Hopkins and starting a new job, because I definitely, I think when you're in it, you feel pressure to conform to a timeline that you think your new employer wants, but there's probably a bit more flexibility than you think, and I would feel free to negotiate that. So in 2017, I joined the health systems team at Path. It has really had a strong focus on analytics and policy and research and evaluation, and I'll speak more to the skill set of the team in a moment. But I joined to lead a project that was a evaluation of global fund investments in several countries. And it was really an embedded research project and really exciting, and has been a great piece of my journey at Path. So I've now been here nearly 5 years, and I'll share a little bit more about the projects I'm working on and have been working on over the past few years. But this curly Q at the end is really supposed to just demonstrate that I think we don't know where our careers are taking us all the time. And I think we've had a lot of reflection in the last 2 years during COVID of the work environment changing. And I think it's an interesting time in international health and how that's changing, and in many ways for the better. But I'm happy to answer any questions if you have more on that later. So a little bit more about PATH. It's, haven't heard of the organization, it started in 1977, so it's over 40 years old, but it is a global team of innovators, and we work to eliminate health inequities. And we really do that through innovation and partnership. That's kind of the bread and butter to our approach. And there's a variety of different skills and expertise across the teams at PATH. It's a really fun place to work. We are working in over 70 countries, and it's a large organization with over 1,500 people, the majority of which work and live in the places that they're from. I think, I'd have to double check this, out of those 70 countries, we probably have between 10 to 15 country offices. It's always shifting a little bit, but so in a lot of places we're well established with a country office. In some places we have project offices, or in some places we might just be working through a consultant. So in terms of the core capabilities and what we do, we have a lot of design and development and scaling solutions in many different areas: vaccines, diagnostics, drugs, devices, and health systems. So there's a whole variety of people who are working on product development and testing and thinking about that side of public health. And then there's also a lot of people on the delivery side of how do you get all of these technologies out and scaled up and used by people, and to address health and health inequities. So I think one of the great things about the organization is there is such depth and breadth that I think is in many ways unique to international NGOs that don't always have. They certainly have the depth, but they might not have the breadth of depth across all of these areas of products and services. So when we're working in innovation and partnership, there's many core areas to that approach. I think what's exciting is the human-centered piece and evidence-based solutions. So from the beginning, we've been doing a lot of work in the product development space, working with end users to develop those products. And I think in the global health space, it's exciting that the HCD, human-centered design work, continues to grow and is really anchoring global health and primary healthcare systems around the user. So I see that as a really great piece of the work going forward. We also have a lot of multi-sectoral partnerships that drive our work. And maybe unique to our approach is a very strong technical advocacy program that helps drive our work and really helps connect to the priority setting in country. So we advise and partner with institutions, investors, social sector organizations, and businesses of every size, and partnership is really core to the approach. And I'll talk a little bit about that in my day-to-day section, because there is a lot of engagement that's happening on the partner side. So specifically to the health systems team where I sit, we do a lot on unlocking implementation bottlenecks. That's really core to what we do. And that's really what drew me to this team, is that there is such a strong emphasis on implementation research. Other core areas are a lot of evidence synthesis, a lot of desk research, landscape analysis, trying to really aggregate the lessons and evidence and translate that into better program design, implementation design. And from that work, we also do a lot of global policy and strategy design. And I would say a fourth key area is really trying to promote data-led action. And because we're sort of health area agnostic, we have some people that specialize in certain health areas, but a lot of people are generalists. So we tend to work really collaboratively across the organization and slot into a lot of different places and bring that systems thinking approach across the organization. So just to highlight on some of the key core areas of capacity in our team, we really try to be responsive to what the health systems question and research area needs. like I said, with the Global Fund project, that was an exciting one because it was prospective and embedded. So we were following investments and implementation of those global funds over time. We provided a lot of technical assistance and thought partnering on health systems design and strengthening. A lot of our work is in partnership to strengthen capacity, and I would say that that's a two-way street. I'm constantly learning through that approach with partners in PATH as well as other partners locally. Policy analysis and research is a core area of technical expertise for our team. I think I already mentioned earlier on the slide about human-centered design, but there is such an emphasis now on user engagement and designing integrated service delivery models, for example, that are really responsive to people's needs and how they want to receive care. And then we also just serve a function of collaborating and coordinating across the organization. So we have some internal communities of practice on health system strengthening and primary health care that really try to, it's hard in an organization of 1,500 people, but really try to knit that across the organization. Maybe before I get into the day in the life, just to do a check, Olivia, if there are any questions that it makes sense to chime in on now.
I do not see any questions. Actually, looks like one just came through. Could you tell more on what skills were expected from you when you started working there after your PhD? Statistical software you used, ?
Yeah, that's a really good question, and it's kind of an interesting one. I think when I left the PhD program, I assumed that I would be crunching numbers all day and doing all the really researchy, intensive pieces of implementation research. But so much of what I did on the Global Fund project was really management and leadership and technical strategy and oversight and partner engagement. And so all four of those things, I would say, are nothing that you're going to receive training on explicitly. I think maybe there's a couple of management classes that you can find here and there at Hopkins, and maybe that's changed in the last 5 years. But so much of this work, probably like most things, is the soft skills, is being able to effectively engage people, having the emotional intelligence to read the situation, managing the workflow to make sure you're meeting deadlines, and being responsible to the donor. And so much of that, as a PhD student, you're kind of protected from. Sometimes your work is tied to the overall deliverables of a project, but not always. It has to be a lot self-directed. So I do joke that in the first, I don't know, maybe a year and a half, I didn't open data unless it was to try to work on my PhD papers to get them published. And part of that is the way the organization is structured. A lot of master's level and program associate level in our team are running analyses. And I think once you get up a little bit more senior to the senior program officer level, you're less in the weeds doing day-to-day. But that's not always the case, and it really depends on the position. So there's a lot of technical advisor positions, super technical. Maybe they're health economist, or just a researcher that is solely in the technical lane and is less on the management side. So it really just depends. But for me, the things I use most often in the analysis framework, in the analysis realm, are Stata and deduced for qualitative, because I really like how you can collaborate with people all over the world and not have to share files, and everything's kind of online. So I appreciate that. At PATH, a lot of people are really skilled in Tableau. We have a partnership with Tableau, and so we end up doing a lot of our data visualization work in that software, and use it, and have kind of used it a lot in our malaria programming and our maternal health programming. And so I think those skills are really, really useful if you, and it doesn't have to be Tableau. I think any data visualization skills are great. And so much of this work, which I don't think I totally appreciated when I was a student, but so much of this work is around telling the story, the evidence. And so I think those analytic skills of being able to translate research into key messages for policymakers or decision makers is just a really, really important part of this work that I think I underappreciated prior to leaving Hopkins. Any more questions?
Yes, there is another question. It says, there's actually a few of them here. So it says, compared to your time working with your MPH, how different was your role working with your PhD?
Yeah, that's a good question. I think, for my MPH, I was really young, inexperienced, and I gained experience on the job, learning by doing. But the piece of that work that will always stay with me is that it is really fun to be out there in the community conducting qualitative interviews, conducting survey interviews. Like that might be, when you're a data collector, that is such an essential part of a study. But as you advance through your career, you are less and less often the data collector. And so I just really cherished that time in DC working on HIV domestic surveillance. And sort of as you move along in your career, you might be less out there and more tied to your computer, which is it's its own thing. That's just the way it goes. But I would say once I took a 6 or 7 year break between the master's and the PhD, and I don't know how usual it is. I think that's probably a longer break than most people take between degrees, and some people just do it all the way through. And I think for me, that was just really important because then I came into the PhD program already having led research in Zambia, worked on projects across countries in Africa, like knew a little bit more about donor engagement, partner engagement locally, how to get through local IRB, all of these things that I think you learn during the PhD program. But I felt better prepared for that and better prepared for probably defining my research question. And I think depending on the kind of where you're sort of nesting your research in your PhD program, you have different opportunities at the graduate research level. So maybe you're a co-investigator or maybe you're teaching more. And so I think it sort of depends on kind of where you're interested in focusing. Good question, thanks.
There are 2 more questions. I don't know if you want to take them before or maybe go through the next session.
Okay, yeah, I can go through the next session and we can go back to them. My screen seems to be a little stuck, so I'm just going to see if I can advance the slides. Sorry, let me stop sharing and reshare. Okay. Oh man, still stuck on this slide. Okay, here we go. So a little bit about the day in the life. I think can't overstate that I spend too much time spent in meetings and sending emails. I mean, it's pretty impressive the amount of time spent on both of those activities. So in a given day, maybe I'm only doing like 3, on a good day, 4 hours of like deep technical thinking and work, and a lot of other time is really spent collaborating. And I think that in preparing for today's talk, I was trying to reflect on working in the NGO sector versus maybe working in the academic route, which was one I had thought a lot about as well. And there are some differences there, and but I would guess that a lot of faculty level people also spend a lot of time in meetings and sending email. Something I don't think I really appreciated prior to coming to Path was how much time the technical people spend on business development. And again, I think there's probably a lot of similarities between academia and INGOs in terms of proposal development. But I think in an INGO, you have a lot more people contributing, and you're going after different types of grants. So there are some differences there, but by business development, I mean everything from desk research to mapping out partners and partnership strategies to the actual technical design of the program. All of that is happening before you even are sitting down to write. If we're lucky, we have a proposal writer, but sometimes you're writing it yourself with a team. And then the budgeting aspects of that, telling your story of why Path has become really important. And so I think reflecting back to my time at Hopkins, I didn't have a ton of exposure to proposal writing or budgeting. I came into a project that already had been funded. And so I spent a little bit of time on concept note writing, but never really had that end-to-end experience. And so I think, if you can get that while you're at Hopkins, I think that's great training. Some people do that for NIH proposals, in the PhD program, which I think is great. So it's a good skill to have to bring into any organization. I also spent a lot of time on technical oversight. So if I'm not the one making a deliverable, then reviewing project deliverables for other people and projects in the team. I do some data analysis, mostly mixed methods. And sometimes, a lot of it can be qualitative. Some of it is quasi-experimental, time series type work. So it's really variable, but I would say I took more of an unexpected shift towards the qualitative route post PhD, and have really appreciated the mixed methods component as well. I also spent a lot of time on partnering, both internally and externally. As I mentioned, with an organization of 1,500 people, it's a very complex organizational structure. So there's a lot of internal engagement and partnering and collaboration, and really trying to build from each other's ideas and put pitches together, concepts together. And that's happening both in the Seattle teams, but also with all of the country office teams. And so that's certainly an area of focus. Over the last year, I've spent a lot of time supporting our primary healthcare strategy development, which I can speak to a little bit more later. And then also there's just overall team management and leadership responsibilities. So that's kind of where I spend a lot of my time. And I would say that of these things, the one that the PhD helps me most with is technical oversight and data analysis. And to some extent, probably strategy, but just wanted to say that there's so much else, that you're not going to be officially trained on it, that you pick up along the way, just learning by doing. And I think just a lot of the skills that you do gain in the PhD or the master's program are transferable to these areas. So the next 3 slides, I just wanted to give a rapid sort of picture of the kind of projects we work on our team, and happy to answer any questions about these. But as I mentioned, the reason I came to Path was for this Global Fund project. It was really exciting project, prospective embedded research to kind of follow what was happening with investments in DRC, Guatemala, Senegal, and Uganda. How are those investments being used? How are they being translated into outcomes? And it was quite a large and complex project because we had 4 different areas we were working in, and there were teams of maybe 5 or 6 people locally in each of these countries that we're partnering with. So it was a project that had a lot of emphasis on capacity strengthening, but really that was all done by learning by doing. And we had a lot of bumps along the way in this project, but in the end, I think it was really innovative and exciting. And hope that there's more opportunities for work like this, because it had such a strong emphasis on mixed methods and data triangulation. And it was largely all secondary data that we were trying to bring together and make sense of. There wasn't a lot of funding through this project to do primary data collection beyond qualitative interviews. So each of the countries were answering their own kind of country-specific questions, and then our role on the global team was really around cross-country synthesis to help inform the broader business model of the Global Fund. So are there insights from these countries that could actually be important to translate across the Global Fund's model? So it was a complex project, lots of stakeholders involved, lots of stakeholder management. I think that was my greatest learning on this project, is around the stakeholder management side. And then on the dissemination and use, another learning, and something that was, I think I underappreciated prior to this project, was just the importance of communication and knowledge translation. I think we staffed the project with a bunch of researchers, mixed methods researchers, but nobody really had that technical expertise in the knowledge translation back to the local stakeholders. And so I think, going forward, I just really want to prioritize that in all projects. The next project that we just wrapped up last month, and it's part of the USAID Engaged Design Mechanism. And so it was a project in Zimbabwe looking at pre-exposure prophylaxis for adolescent girls and young women. And it began by trying to figure out, well, how do we shift the messaging from let's not get HIV to let's empower ourselves to protect ourselves with PrEP. And so there had been a lot of early work on this project on the human-centered design piece, which was led by Matchboxology, which is a partner in South Africa. And then Pat's role was really, once that that branding strategy and that intervention was designed and had all the user inputs, we were really, creating the learning agenda around what we were trying to figure out during the pilot implementation. And, as this rolled out over 3 months, was really looking at, okay, what can we learn in those initial implementation months that are going to help with ongoing implementation, and advise the government on scaling up this project to the public sector. So it's been a really, really interesting project, and one that I think has the capability to be relevant, not just in Zimbabwe, but across many countries that have a real need for a different strategy for reaching youth and reaching adolescents with something that's attractive, and they're curious about it, and they want to learn more about PrEP. And it really has played a role in sort of trying to destigmatize PrEP for this population. So those were both examples of more implementation research, but this example is more on the learning side, and it can be applied to implementation research, but wanted to share that one of the projects I really enjoyed working on over the past couple of years was work where we were trying to develop a toolkit that would help sort of speed up the process of learning and rapid evaluation, because I think there's such a need for fit for purpose designs that really answer the question that a decision maker is trying to answer, and they don't have to be the most rigorous design out there, but they have to be practical and fit for purpose and cost effective. And so we put together this toolkit to advise campaign managers on kind of looking at their campaign rollout and figuring out if there were bottlenecks along the way and how they could adapt to make the rollout better and stronger. So encourage everyone to take a look at that toolkit. If you're curious about it, it includes a component on root cause analysis, which was something I definitely heard about while I was at Hopkins, but is something that has been really core to most of our projects on the health systems team. And then a second toolkit more about the approach that we call REAL, which sort of outlines this model on the right-hand side around really mapping out your theory of change and figuring out which of those connections do you need to measure because you're not really sure the relationship, and how do you learn through this process and adapt as you go to make the campaign rollout more effective. So this is a tool we're using in the Momentum 3B MWrite activity, and it's working really well. We're excited about it and hope that it can be useful to others going forward. I think before we turn back to questions, I'll just say a few reflections on things I wish I knew a while ago. One is around this communications and dynamic storytelling. I think, you know, a lot of time in PhD program, the master's program, there's so much emphasis on peer-reviewed literature, getting your manuscripts out there. But the reality is those manuscripts, you know, reach a certain audience, but there's a whole other audience that is reached through blog posts and other webinars and other types of storytelling. So I think we're all at paths trying to get better at storytelling. And I've really realized the value of building communications and even graphic design and things like that into your grant budget, because I'm not an expert in that stuff. And graphics people can make everything look prettier and more approachable. So highly value that. I would say, like I think I mentioned this earlier, I didn't get a lot of formal training on the science of management or leadership while I was a PhD student. I think, you know, just through jobs, you pick it up along the way, but there's a science and there's an art. And I think the art piece you pick up along the way, and the technical piece, I think it's, you know, if you can seek out those opportunities, I think it's never a bad idea because it's such an important piece of partnership and effective leadership. And then just doubling down on efficiency, I think everyone is so overloaded. There's a million priorities. You have to be able to focus and figure out what's most pressing and prioritize, but you also need to be highly efficient. And I think for much of my career, I've just been really detail oriented and really in the weeds. And it, as a result, takes a long time to do everything. And I'm working too hard and working long hours and have really, this is hard to do. I think work-life balance is an everyday struggle, but really trying to focus on being more efficient and giving something the time that you have available, but not, you know, it will bleed into however long you give it. So really trying to cut that off. And then to say just what I'm excited about going forward is in the last year, we've come up with a new strategy for primary healthcare at PATH, and we merged several health verticals and the health systems team to create this bigger program with a stronger emphasis on primary healthcare and de-siloing all of our kind of vertical programming and trying to work together and figuring out where there are opportunities to integrate. And I see that even if donors are not funding work in that way yet, that is really the way of the future, and we're pushing towards that. And that's the way that Ministry of Health wants to operate. They don't necessarily want to operate in the siloed fashion anymore. So I think there's just going to be a ton of opportunity around that, and really excited for it. There's also a growing emphasis on urban health and the unique complexities of the urban environment. And so I'm hoping that leads to more opportunities for research and evaluation. I think, you know, increased migration, everything, that people are moving to cities, and we're going to need stronger, better, more resilient health systems in cities. So I see that as an area of just great emphasis and promise over the next decade plus. And that links actually to the fourth point around climate change and public health. I think it's an area where I don't know how much the coursework has changed at Hopkins over the last 5 years, but I don't remember this being on the radar as much, maybe a little bit to some extent. But it's just in the last few years, I feel like it's just on the agenda, and as it should be. And I think the more you can learn about, carve out space in this area, become an expert, I think it's going to be highly valuable going forward. And then the third point there on the localization agenda, I think, you know, we're really focused on creating stronger local partnerships. And I think through that is, PATH is working on our approach to capacity strengthening, really defining that, because I think there's so much embedded in that. And, when we think about our primary donors, which are USAID and the Bill and Melinda Gates Foundation, especially with USAID, it's a complex funding environment. It is hard to get that funding. There's a lot of contractual pieces there, budgeting pieces that is going to require a lot of training capacity building on to shift the funding directly to local organizations. But that's where we're moving, and that as we should be. And I think that there's going to be a lot of work in that space in the next decade as well. Before we open it up to questions, again, just wanted to say that we are hiring on my team, so please check out the PATH career site. So we have a really exciting opportunity for senior learning advisor on the MRIGHT project, the Momentum Routine Immunization, Transformation, and Equity. And happy to answer any questions about that opportunity, but it's a great project and it's a great team and really exciting. I think there's probably nothing more pressing right now than COVID-19 vaccine rollout and routine immunization systems. So definitely check that one out. We also have a program associate position focused on primary healthcare that's just opened up, which is a heavy emphasis on data and analytics and data visualization. And also, I think when we think data visualization, we're usually thinking about quantitative data, but this one is mixed methods, and that's a really exciting piece of how do we bring the qualitative into data visualization. And it has a strong focus on maternal and child health. And yeah, check it out. I think it's a really great opportunity for a master's level candidate. Well, I didn't know how many questions you guys would have. So if we run out of questions, I do have a question for you about where you think the future of NGOs is going. And I'm also happy to chime in on that one. But maybe before we go there, if there are any other questions that have come up in the chat.
Yes, there were two other questions. The first one is, do you work with any medical doctors? If so, do they apply their medical knowledge to their work?
We do work with a lot of clinicians, doctors, nurses, and they're really essential to the work that we do. I think the technical credibility of the organization rests on having that really strong clinical expertise. So, and that's, on the global teams, that's on the country teams. So definitely that's a really valued skill. Sorry, was there a second part to that I missed?
Nope, it was just that part. And then there is another question. It says, could you share what are some skills and jobs that are needed and exist within HIV service implementation science field?
Yeah, that's a great question. I think there's so in the HIV field, definitely a stronger emphasis on integrated service delivery. And with the way that funding flows through PEPFAR or flows through PMI for malaria, I think we're all watching to see what happens, because those two large, very successful global initiatives by the US government, have a stake in also wanting to retain funding to deliver those programmings that has historically been very verticalized. So now I think what's happening during COVID is, this is really a moment for health systems. People are talking about health systems more than they've ever talked about health systems. And so I think for PEPFAR and PMI, that means, okay, how are we going to integrate health system strengthening into our portfolio? So I see a lot of opportunity for looking at health systems and, how can HIV care be integrated with NCD care, with TB? So really, like, if a person walks in, we're treating them holistically, we're thinking about their full life course instead of just having like dedicated HIV specific clinical care. So there's so much innovation, I think, that could happen in this space. So I think skills that you need for that are just certainly like strong data analytics skills, but also just thinking about the health system, thinking about the way things flow. We're doing a lot of innovative work in India in the TB program to connect public and private sectors so that people with TB are getting the right, they screen for TB, they're getting the right care, but while they're getting the TB care, can we screen them for NCDs and hook them up with medicines that they might need for that. So it's taking those opportunities when you have patient contact to see what else you can offer to increase health. So just on the skills question, I think, pitching innovative ideas and concepts, I think, there's still need for innovation, but I will say a lot of the work that has been done over the last 20 years, we've found a lot of great solutions, and what's happening is they're actually still maybe stuck in a pilot phase. They haven't gone to scale. And so one of the projects that we're currently working on is, for some of those products, why are they getting stuck? Why are people not getting these innovative new technologies or products or services? And where are they getting stuck? And so I think there's a lot of interesting research that can happen to look at that and to try to unblock where they're getting stuck to increase access. It's a good question. Thank you.
That is the only other question that I see in the chat right now. I don't know if you did want to have folks tackle the question that you have on the screen or answer yourself.
Sure, I would love to, well, let me just say one reflection point, but I would love to hear from students on this question because I think it might also shape what you're thinking about in terms of a career and jobs and everything. But the last 2 years have been very different from the first 3 years I had working at PATH. When I was working on the Global Fund project, I basically traveled every other month. I mean, I was on the road all the time. And a lot of that work was, either going to Geneva or to countries to work together on the project, on data collection, capacity strengthening analysis. But it was exhausting. I mean, I shouldn't have been traveling that much on reflection. It was a lot. And, in the last 2 years, there's been no travel. And we've learned how to do everything remotely, and there are certainly pieces of that I miss because the in-person connection is so important. But I also think, we were doing a lot of terrible things to the environment by flying that much, and was it really necessary? So I think about that a lot in terms of where the NGO sector is going, or the INGO sector is going. And then I think there is a need for us to learn and adapt as a sector, and I'm interested to see where that goes regarding just like increased capacity for local NGOs to receive these large grants directly. So I think there'll be a lot of work in that space going forward, but would love to hear what others are thinking about the future of NGOs, and or if you have other questions.
I don't see any other questions in the chat at the moment. Oh, we have someone who raised their hand. If you want to go ahead and unmute yourself and ask your question.
Hi, can you hear me?
Yep.
Yes.
Okay, great. Catherine, thank you so much for your presentation. I think this is a great question to get us thinking about the difference between the roles of international versus local NGOs. And I think on our talk earlier today for NGO Day, we were thinking about like international positions. And I think it's been harder as a recent grad from the MSPH program to find those international opportunities, because a lot of the funding is going toward these local organizations in terms of localization of global health funds and just the whole decolonizing global health. And so I think that is the correct direction that the field should be going, but it also changes the role, I think, of like Hopkins graduates, of people who are coming from like the United States, being educated there, and what the job opportunities are. So I don't know if you have any insight perspective about that, but that's a challenge that I've been finding.
Yeah, I would echo that. I think that it's probably, well, at least at PATH, we usually focus recruitment locally to nationals from the country where the project is taking place. It's pretty rare that we do an international recruitment for those positions. And so I don't know if that's the case for other INGOs, but that's sort of the way that we've been trending. I think there's still ways you can get that in-country experience with different types of NGOs or with academic opportunities. I don't know, things like Fulbrights or other scholar appointments. You could move directly to a country and implement, your NIH project directly or things like that. So, there might be more opportunities in the academic side to get a position and co-locate at a university, in partnership with maybe a US-based university as well. So I think you can try to get creative, but in terms of more of the MPH level opportunities, I think that you're probably right that those may be a little bit limited at the, currently, and especially that I think might have changed also during the pandemic, and might have seen that trend just increase faster.
Thanks for that. That's helpful.
Yeah, good question.
We have one last question in the chat. It says, do associates engage with multiple projects simultaneously? If so, what are the key things to manage several project deadlines at the same time?
Yeah, that is such a great question, because I think we have a tendency to overcommit, and I'm guilty as charged, and it's a constant struggle to say no to so many interesting projects, because it's fun to get involved in multiple things. So I think at the associate level, you probably wouldn't be on more than like 2 major projects, but I think it's a real luxury if you're only on one, because you can be really focused. But on the other hand, PATH, we like, I think, to have people on a couple of different projects, because funding cycles are constantly changing, and one project might be ending, another one's starting, and so usually you're on at least 2. And I think the key is really communication with your manager. And if you're working with 2 different project leads, to make sure that they know, just stay in touch, on a weekly basis on what your priorities are and if deadlines need to shift, because usually there's flexibility with a lot of internal deadlines. And I think where things start to get a little trickier is with the external deadlines and making sure everyone is on board. But it's a good question, because you as an associate level, you do want to get involved in all these different things and make connections across the organization. And I think that's one of the fun parts of it is working across a lot of different teams and different opportunities, because you build different skill sets, and each kind of learning that each team kind of has their own culture. And so I think you get exposed to a lot of different opportunities. I think at the program associate level, you might be less involved with new business development, so consider yourself lucky. But I think it is, I'm often pulling in a program associate to help with literature review for this concept note or that. So there are opportunities to get involved. It's not all project specific work. But that's a really great question, and I'm sure at Hopkins, you're familiar with balancing multiple priorities. So you're already building that skill set, which is great.
Thank you, Catherine, so much for your presentation and answering those questions. I believe it's definitely been really helpful to have this information. I will make sure that everyone has access to this recording, and our next session is actually happening just in a couple minutes. So if you want to join us over there, again, I thank you so much for all of the information that you provided, Catherine. And we're excited to have PATH at the Career Fair on March 4th. So definitely take the time to kind of learn a little bit more about the organization, and you'll be able to meet with them in a few weeks.
That's great. Thank you so much for having me. It's been a real pleasure. I love hearing your questions. Feel free to reach out to me on email or connect on LinkedIn if you have questions. And yeah, my colleague Yvette will definitely be at that session. So hope you can attend and check out our jobs. We're really looking forward to hiring some new people on the team. So thank you.
Absolutely. Thank you. Bye, everyone.
Thank you.